Welcome to Sleep Talk with Dr. Dev and my assistant Barney. Barney, we're on location today. How you doing, buddy? All right, Dr. Dev. Today we're going to talk about insomnia. Insomnia is a term that many describe just not sleeping well, just not feeling refreshed. I know exactly what they're talking about, but insomnia has distinct definitions. Number one, inability to get to sleep. Number two, difficulty in staying asleep. And number three, early morning wakening. And chronic insomnia tends to be sleep disturbances like this for over 3 months. Now, many of my patients who don't sleep well don't say, Dr. Dev, I have insomnia based on 1, 2, 3. They say, I don't feel right, I don't sleep well, I just feel tired in the day. So when I see somebody in my clinic for the first time who's been having sleep problems, I usually ask them a number of questions or history taken to try and work out what type of sleep issue it is. And there's 4 broad issues. The first one that's very common is the hyperdrive sleepers. In other words, their sleep is very busy. It's flight, fright and flight, full of cortisol, full of adrenaline. And these are the people who have anxiety or ADHD or bipolar or PTSD. Certainly the mental health patients that I see, that busy brain, and that they wake up, even if they've had 8 hours of sleep, they feel exhausted and tired and just not ready for the day. The second group of individuals I see is the fragmented sleepers. They may spend an hour or two trying to get to sleep, and then they sleep for an hour or two, then they wake for an hour or two, and then it's just a complete mess. It's like chopping up a cucumber. A bit here and a bit there. And these fragmented sleepers, I see quite a lot in people who've had chronic depression. Almost their sleep broken is entrenched. Very common in dementia as well, and neurodegenerative conditions like Parkinson's disease. They may not have that busy brain, but they're almost programmed not to sleep in big blocks of sleep. And they have tremendous amount of ill health and well-being issues in the day. The third group that's very interesting is the restless sleepers. These are the ones that might have restless legs and they toss and turn and just can't quite settle down. Also the sleepwalkers, the night terrors, those that have circadian rhythm disorders, such as delayed sleep phase syndrome, where the brain just won't switch off. And these restless sleepers have quite incredible difficulty in getting to sleep and can cause even more anxiety and more stress of not getting to sleep. And then the fourth group is the noisy sleepers, the snorers, the ones that stop breathing at night, like the sleep apneas. But they may also have hyperdrive and fragmented sleep from mental health or depression or restless sleep as well. But those are the 4 basic groups that I look for in a patient and try and work out which quadrant they fit in. But ultimately, doing a sleep test and understanding the breathing, how much sleep and quality of sleep they get, is a key part of their assessment. So all my patients that come our way do have a sleep test, a simple device that they take home, monitoring the brain waves, the EEG, or the breathing, and then I catch up with them after this and say, okay, you're a hyperdrive sleeper, a fragmented sleeper, restless sleeper, or a noisy sleeper. And that's when I'm able to find a solution for them and fix their sleep. So if you think you fit in one of those 4 quadrants, go and get a sleep test. Go and see your doctor, get a referral to a sleep specialist, and let's try and find a way of how you can get better sleep. See you next time.